All right, so we're here with Dr. Diane Morris of Meridian Health Services. First of all, doctor, could you explain what your mission is here?
Yeah, I'm the medical director, and my mission is to promote recovery in all the different ways. I think that the journey to recovery is very individual, and individuals have the right to define what that recovery involves and looks at. Some patients want to get off everything and look at abstinence, both from alcohol and from other medications. Some patients need more help. I'm a board-certified internal medicine doctor as well as a board-certified addiction medicine specialist, and my past internal medicine journey dealt with treating many chronic diseases like diabetes, high blood pressure, thyroid disease, and in that journey I certainly found nobody who ever said, gee, Dr. Morris, I really want just medication for my diabetes or just medication for my high blood pressure. We understood that patients require lifestyle changes and medication to be really successful. And sometimes we adjust medicines, sometimes we stop them. It's no different treating substance use disorder. When you have severe disease, patients frequently need medication-assisted treatment, and sometimes they can change the doses, change the medication as their disease progresses, as their recovery progresses. But it's very different for each individual.
Tell us about how someone who, when they're going through and they're thinking about coming to Meridian, how can they make that decision? What is the push? What should be the last straw or before the last straw?
You know, you'll hear people throw around, they've got to hit bottom. Bottom is a retrospective place. Bottom is when you're in recovery, you can look back and say, that was the event that caused me to see change or seek change. And we can't tell another person what that is. You know, I have patients that I'd say, well, you know, your wife left you. That seems like a good reason to stop drinking or to stop using. But it isn't. You know, they need to find their own motivation for change. And part of what our counselors do really well is work on, the term is motivational interviewing, which is trying to help a patient find their motivation for change. And I think most of our counselors do that so well, just moving people through the stages of change. You know, there's a stage of change called pre-contemplation. That's where you're not really thinking about it at all.
That's not me. I don't need that.
Yeah, okay. I don't have a problem. I don't know why you'd even mention it to me. And then contemplation is where you start to think, yeah, you know, maybe I need help. And that's why when we talk about treatment, we don't just talk about giving a medication. We talk about a 360-degree supportive service. And almost all of our clients come in with some chaos in their life. They need help and support and direction, but it's something they have to decide themselves. I might think, well, this worked for this guy, so this is exactly what you should do. But it may not work for that next patient.
Do you think that people they think that's not me because there's a stigma attached to substance abuse?
There is no question that there's stigma and that it affects every aspect of treating substance use disorders, starting with the patient themselves. They feel like let me start that again. They feel such overwhelming shame. They somehow feel that they're not good enough because they can't just put it down. They can't just stop. The more we understand this is a brain disease in an involuntary part of the brain, trying to just stop a craving is like me trying to say, I'd like my heart to beat at 65 beats a minute. Pretty impossible. No matter how much willpower and want to I have, I can't control how fast my heart beats. No matter how much willpower and want to my patients have, they can't just stop using, because it's a feeling disease, and it's the inability to reduce the hormones and chemicals that come with big feelings. They can't get back to a normal state. So they ultimately have to know what to do with that. That's what therapy is about. That's what, one of the things Meridian also does well is we have peer support services. So this is another person with a substance use disorder helping our patients and saying to them, this is what I did. Try this, concrete, one step at a time answers. I think it helps.
Meridian is different a lot because of the programs that you offer, but also in terms of the way that healthcare and support services are changing for people with addictions.
Right. I think I think one of the things that we are trying to do and developing and is constantly expanding is working to give our patients a continuum of care. So that everything from early recognition of their problem, to detox services, to inpatient residential treatment. When we treat patients, like in inpatient residential for 2 to 4 weeks, we don't think they're fixed. Their families might think they're fixed, but they're not fixed. It's a brain disease, and it's a chronic, fatal condition that can be put into remission with daily treatment. And it takes a while for that patient to lose the shame, to start feeling comfortable in their skin, to really have the ability to interact with their families, with their professions, their jobs, their community. But real recovery involves all of that, so they have a healthy lifestyle, they can have a spiritual life, they have support from family and friends. Recovery is an individual having hope. And that's, I think, what we can give them. If they need medication-assisted treatment, and I would tell you many of our patients do, particularly with opiate use disorders, there are medications that are approved now. Part of the stigma is that the community says, well, that's a crutch. You're just replacing a drug with a drug. We don't look at any other chronic disease that requires medication as a crutch. Yes, my diabetics do better when they, eat less and exercise, but nobody says, well, you shouldn't give them insulin. You should just make them hit the gym 6 days a week instead of 3. We don't do that, but we do that all the time with substance use disorder, all the time. And patients somehow hear that in the community and say, I need to be off this drug. But these are not drugs, these are medications. And as a board-certified addiction specialist, I don't give the same drug, the same dose to every patient.
Each person is different.
Each person is different, and we look at, in dosing, we look at what other medications they have, we look at drug interactions, we look at side effects. A 19-year-old is very different than a 69-year-old. So, you know, I use all my professional skills to determine the right medication for this patient.
Is there anything else that you'd like to add?
I just want to emphasize that when people come in, they're suffering, just like somebody with any disease. They come into our offices, into our buildings, in pain. And I think recognizing that the journey to recovery is difficult, and the more we offer these patients all the supports that can be available, the better they do.